Infusion and injection coding tips and tricks. I'm going to start the presentation now, so just bear with me a second. I want to make sure that you're able to see my screen before I go any further. Okay, all right. Okay, so today we'll cover a basic overview and progression of infusion therapy. You will master hydration, infusion, and pediatric vaccine coding. We're going to nail down the billing hierarchy for infusions and injections. You'll also have the opportunity to power up your knowledge of HCPCS and key modifiers for infusion and injection billing. You'll get to know the documentation pitfalls and gain helpful recommendations from CMS. And then we're also going to highlight a couple of useful resources and tools. So let's go ahead and get started with a lot of information today, so we'll go ahead and jump right on in it. Okay, so infusion and injection therapy was first researched and attempted in the 1600s. In 1656, Sir Christopher Wren injected opium intravenously into dogs. In 1662, Johann Majors made the first successful injection of unpurified compounds into human beings, although death did result from infection at the injection site. In 1665, an animal near death from blood loss was saved by the infusion of blood from another animal. And then in 1667, a 15-year-old boy was the first human to receive a transfusion successfully, and lamb's blood was administered directly into the boy's circulation. So there have been significant advancement seen in the 20th and the 21st century. In the 1920s, dextrose was the first used as an infusate. In the 30s, the slow drip method of transfusion was developed. In 1940, disposable administration sets were developed, and then in 1945, the flexible IV catheter was introduced. 1960, peripherally inserted catheter lines were introduced, and then in 1970, the Centers for Disease Control, the CDC, developed IV therapy guidelines for the first time. And then there was even more advancements that were seen in the 1980s and beyond, and these include implantable ports, home infusion, transfusion, home blood transfusion, development of the osteoport, increased usage of pain control analgesia. National Standards of Infusion Practice was issued by the National Intravenous Therapy Association, or NITA. The first credentialing exam for nurses was offered by the NITA, and the NITA changed its name to the Intravenous Nursing Society, and then there's been a whole lot more improvements and development since. Okay, so what does CPT say? It's crucial for coders to understand the billing hierarchy. This is the manner in which IV injection and infusion drug administration and CPT codes are submitted to payers. The facility setting is subject to the billing hierarchy, but not the physician office or clinic setting. According to the facility Cpt Coding Hierarchy, your chemotherapy services are primary to therapeutic, prophylactic, and diagnostic services. And then these are primary to your hydration services. So infusions are primary to pushes, which are primary to injections. And we'll go into that a little bit more over the next few slides.